one of the sort of key findings that we found was that older patients and female patients were higher risk of developing uveitis, as well as sequelae or complications of uveitis. And actually, patients who were of higher socioeconomic status were more likely to be diagnosed with uveitis, to have incident uveitis, but less likely to be developing complications from uveitis. So that sort of disconnect lets us think about, or leads us to think about, what are the healthcare disparities that are leading, even though these patients are more likely to have be diagnosed with uveitis, so they have possibly like an increased ascertainment bias because they're more likely to access care because they're of higher socioeconomic status, but they have fewer complications from it. What are some of the barriers that are causing patients of lower socioeconomic status to be at higher risk for developing complications from uveitis, and how do we address those? So infectious uveitis are often viral, like herpes viruses cause a fair amount of uveitis. And then in the developing world, things like tuberculosis and in immunocompromised patients, things like syphilis and patients who have HIV, for instance, are also at increased risk of developing a CMV infection, CMV retinitis. So certainly we found that there are different associations with various comorbidities for infectious uveitis. And then the other subgroup was non-infectious uveitis. So that's we did find that there is an association between systemic autoimmune diseases, things like rheumatoid arthritis, lupus, ankylosing spondylitis, inflammatory bowel disease, Behçet's disease. Those are all associated with an increased risk of developing various forms of non-infectious uveitis. One thing that we did find was that that was a little bit surprising to us, is that patients with uveitis were also more likely to have very common other chronic medical diseases like hypertension and diabetes, which aren't classically thought to be associated with an increased risk of uveitis. So that's certainly some of the data we're delving more into to see if that's a real signal. Yeah, I mean, as powerful as the Optum database is, it utilizes just health insurance claims data. So there's not a whole lot of direct clinical measurements, nor are there a lot of measurements about like quality of life effects on patients. So I think more research can be done to help understand what are the actual day-to-day implications of uveitis or on vision impairments and vision-related quality of life and patients' activities of daily living and their overall functional status. So I think demonstrating that effect and how different treatments can improve that is certainly a next step.